Thank you very much. Good evening. I would like to respond right away to the high proportion of men who are doing trainings, and I I like that very much. Look at the pictures and see how many men we have at simulation center of our center, how many young trainers we have who are training the basic caregiving skills. We have also quite a number of them there, just like in the Vitebsk region, I guess. My story goes as such. When I talk about our simulation center, these are some of the numbers, but behind those numbers, we can see a lot of history. Our simulation center project is 5 years old. We've been there under the supervision of the Department of Social Protection as a special institution for caregiving skills. And when our simulation center was inaugurated, we already had by that time some previous experience and ideas and a collective of same-minded people who were the authors of this simulation center opened on the premises of our Geronto Psychiatric Center in Moscow. We have already a total of 15,000 alumni, more than 25 training programs, one way or another, related to the caregiving skills. These are the programs which shape up, develop, improve both hard and soft skills of a person who is involved in caregiving. And the system of the simulation center is based on 5 thematic zones or 11 stations, each one of them equipped according to the modern standards. And I can say that initially we decided to follow certain values here. We're not training remotely, we're not training online, we are not doing theory at all. We work only with practical skills development. And we decided right away that our groups of trainees should not increase the number of 10 or 12. Only under such circumstances, our trainers and teachers have a way to do hands-down training in the algorithms of caregiving. And this way they can pay enough attention to each one of the trainees. Because we keep saying that the caregivers are the persons with a large heart, big soul, great human heroism, and hard labor. For such people, especially for caregiving assistance from our social homes and gerontological centers of Moscow, we created such a simulation center. But as of now, we can already teach anyone we want. Any person willing to can approach our simulation center to undergo training in caregiving skills. Yulia Makartseva in her presentation already mentioned that if submitted by social coordinators, any person who is checking out their relative from the hospital goes to us. Within 10 days, we can train them free of charge under our programs and trainings. We can provide this free of charge training to any specialists from the institutions under the Department of Labor and Social Protection of Moscow, also to some other categories of citizens like students from the College of Social Professions. From our department has a different name. It's called College of Good Deeds. It's its official name. We also train them in the profession of caregiving. And ever since 2023, when we saw that we inspire a lot of interest from more than 450 people, it's even more than 500 as of the end of September, from more than 35 regions of Russia and other countries visited our center to learn from our best practices. What other principles and ideas were invested into the simulation center operations? This is what we are ready to share. We always invite people to our center. We keep saying that a picture is worth 1,000 words. Maybe photos can show the situation we work in. Clean practice, we work with hands through the immersion into the internal world of people who we provide care to through the caregiving situation. We have created and tested a number of curricula and training programs, and after our first groups of trainees, fully armed with the knowledge and skills trained to them, return to their permanent jobs, we saw from their feedback that they make less mistakes in their daily practice. As for Muscovites who take care of their relatives and loved ones at home, what is the problem? It is hard work, of course, both to the people who are suffering from the disease and people who are caregivers. The principles we teach them there first, you take care of yourself, of your safety, of your mental and psychological status. You take care of your back and knees. Eventually, you take care of your own drinking regime to fully understand the needs of the person who you're giving care to. If you're taking enough care of yourself, you'll have enough resources to give care to the loved one, to your charge, to the inmate, as we call people who are staying at our gerontological centers. Yet another specificity of our simulation center. We have decided that we're not going to force on others any specific training programs. We always are based on the needs and requests. And if a social house or a Muscovite or another institution comes to us asking for help, we ask them in return, what do you need? What kind of problem would you like to address? What kind of equipment do you have? How do you do different skillful manipulations? I must say here that all the social homes and gerontological centers use the same set of standards of care giving, and we teach them based on the standards adopted by the Department of Labor and Social Protection of the city of Moscow. And yet, still, everybody has their own context, working with different categories of citizens or patients, and we consider all those factors, and we can easily construct or reconfigure special trainings, courses, or master classes, or any educational product based on the context and needs of a particular stakeholder. The personnel training system, I mentioned men. Today, remember, about 26 people of our staff, out of 26 members of our staff, we have 3 senior trainers, others just trainers, every day, 5 days a week, and sometimes even 6 and 7 days a week. They teach caregiving to whoever comes to our simulation center. We have up to 10 groups per day, so up to 100 days are housed by our small simulation center per day. And we also handpick our trainers so that they could use versatile, universal methodology to follow algorithms and standards adopted at our institutions. As for the practice-oriented approach, we have not a single classroom where we would have a set of chairs for long lectures. Of course, we have a couple of chairs in some rooms, but our trainees come in and start working and start learning professional skills under the conditions which are as close to real conditions as possible. Another life hack that we found for ourselves, we have, of course, mannequins, high-tech mannequins, we have AI, we have VR glasses that are supposed to help us. Of course, we use all those gadgets, but best still, training can be organized when one of our staff members plays the role of a patient and immerse themselves into the world of a person in need, and another trainee is providing care, learning on that person how to give high quality care. It gives us better understanding, it immerses ourselves, and it gives us empathy and feedback. Sometimes it leads to tears in the eyes and other emotional outbursts, but this facilitates the development and learning of those values that we follow in our work. We keep saying that there are 5 zones. Any person requires care, respect, safety, hygiene, and movement. These are the main basic needs of any person that need to be provided to that individual who requires external care and assistance. Whenever our knowledge achieves certain level, we decided that we can arrange yet another training programs that we called trainer/teacher, modern approaches to caregiving. This is the program for you, program for regions, program whoever is willing to learn these skills, whoever wants to come back home to their community, to their residential area, their country, and with the knowledge of how to build a training module based on the practical skills learned at our simulation center. And that person will be able to start training others how to learn these caregiving skills.
So here are the links to our various social media, Telegram, VK, our website, where we share information, all the information. That's where we post our tutorials and educational materials. The next 3 Mondays you will see us in the Elena Malisheva TV show To Live is Great, where we'll talk about caregiving. Most importantly, the key message that we'd like to instill in everyone who crosses our threshold is that doesn't matter if we may make home visits, if we're visited by delegations, or if we hold courses. The key message is that a human being needs another human being.